Us today. Welcome to the Munson Healthcare COVID-19 press conference. Today is Tuesday, April 13th, 2021, and my name is Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare, and I'll be your host today. Next slide, please. As a reminder, Munson Healthcare hosts these weekly press conferences to keep you up to date on the latest information related to COVID-19 and vaccinations. There are other ways that you can stay updated and connect with Munson Healthcare. You can sign up for our e-newsletter, follow us on social media, or always visit munsonhealthcare.org for the latest FAQs and information, especially related to visitation policies and current policies in force at Munson Healthcare. Joining me today, I'm happy to have back Dr. Christine Nefsey, who's the Chief Medical Officer for Munson Healthcare. She'll be taking us through the standard statistics and any updates related to Munson Healthcare's visitor policy. Also joining us again today is Dr. Christopher Ledke. He's an infectious disease physician with Munson Healthcare, and Dr. Nick Tourney, who's the infectious disease PharmD with Munson Healthcare. And again, I'm Diane Mihalik. Next slide, please. So without further ado, I know we're going to have a lot of questions today. I'd like to introduce Dr. Christine Nefsey, Chief Medical Officer for Munson Healthcare. Thanks for joining us.
Thanks, Diane. Well, let's go ahead and get right into the numbers. You can see here we continue to have an increase. I won't read all the cumulative numbers, but you can see both at the state as well as our regional level, we have seen a pretty rapid increase in the number of COVID cases that we are seeing. Our 14-day average today on a rolling 2-week average is the highest. We've seen it at 17.5%. We have been there for the last 2 days. Next slide. The increase of cases in our community has also led to an increase in the number of inpatients that we have. So you can see here we currently have 85 positive COVID patients across the Munson Healthcare system. We have had also, with this latest surge, slight increase in the number of employee positives, certainly not as many as we saw with the surge before the vaccine was in place, but we still continue to see a small number of employees test positive as well. Next slide. This just shows you in a graph format of where we are, and you can see the surge we had in the late fall, and then now our surge here. And it is evident here that we have, again, seen some of the highest numbers that we've seen during this entire pandemic with this most recent surge. Next slide. I do want to make the point that we have made earlier. The patients we are seeing come into the hospital and require hospitalization are younger than we saw in the fall. We are seeing a lowering in the average age of those patients, as well as a higher number of those patients. We are directly attributing that to the success that we've had in vaccinating our older patients in the population. So you can see here at the state level the correlation between being immunized and your decrease in risk of hospitalization. Next slide. And so just to kind of review where we are on vaccine coverage, the state has given 5.3 million doses of vaccine. And so when you look here at the coverage rate, it's just above 40% for the state. Next slide. And here in northern Michigan, we're actually approaching 50%, which is, again, good news. Next slide. At Munson Healthcare, we have continued to work with our primary care clinics and our regional health departments as we have ended our mass vaccination clinics and moved to supporting the health department's mass vaccination clinics. We have given over 63,000 doses of vaccine here in northern Michigan. Next slide. You will still know that the federal government is allocating vaccine directly to retail pharmacies. So there are very many pharmacies around our northern Michigan region where you can also have access to vaccine. Next slide. If you have questions about the vaccine, and we know there are quite a few questions out there, we do have an Ask a Nurse vaccine hotline. You can call the number 231-935-0951 and get all of your questions answered. We do always invite you to talk to your primary care provider who knows you from a health perspective better than anyone, but this line is also available to you for questions. Next slide. We do know visitation has been sort of a source of frustration for many people as we have traversed through this pandemic. We completely understand that families want to be with patients, patients want to be with their loved ones during this time. We are considering the visitation to be expanded from our current state to include some visitors who are vaccinated on a limited basis. We do want to make clear, though, that we are still limiting limiting visitation to our inpatients as we deal with these variants and a much higher caseload across the Munson Healthcare system. Those do change, and they are often different in a long-term care facility than they are in a hospital. So we do invite you to check munsonhealthcare.org for details, or call the place you're going to if you don't or unclear about what the visitation policy is. And as always, we urge you, if you are eligible, to please get vaccinated. And Diane, I will turn it back over to you.
Great, thanks, Dr. Nefsi. And I just want to clarify a little bit more on that visitation policy. Thanks for mentioning it. So just to be very clear, we currently do have visitor restrictions across all Munson Healthcare facilities right now, and there are very limited exceptions. Very soon, possibly even this week, we will be considering and implementing some opening up of that policy to some individuals who can show proof of vaccination. And again, that will be on a limited basis. So what we encourage you to do is continue to check our website before you visit a Munson Healthcare facility, so you know exactly, depending on what facility you're entering, as Dr. Nefsi mentioned, could be different from a hospital versus a long-term care facility or an ambulatory clinic. But we are trying our best to get families involved in the care and the healing of patients. So please stay tuned for more details. But right now, as of today, our current visitor policy does remain very restrictive, with only a very few exceptions right now. But hopefully we'll be able to help families out in the near future here. Thank you. Just wanted to clarify that a little bit more. So next, I'd like to introduce Dr. Christopher Ledke. He is an infectious disease physician and expert with Munson Healthcare. He's been with us in the past. And Dr. Ledke, please tell us what you're seeing with relation to the variants and anything else you want to share related to the latest on COVID-19. Welcome.
Thank you, Diane. And thank you, Dr. Nefsi, for having me. I wanted to start by painting a picture of where we're at in the midst of this outbreak. So you just heard some data from Dr. Nefsi, and we have a higher percent positivity, hospitalizations, new cases. These are the highest we've seen. So it's hard to imagine that it's been almost exactly 13 months since our first case in this area, and we're as bad as we've ever been. So I mean, this thing is raging right now, and that's for a couple of reasons. You'll notice that the slide that's up includes the amount of variants by state, and Michigan has the second highest number of variants recorded nationwide. So we have a significant amount of variant spread. And the way that this is documented is, or measured basically, is the state is testing a certain percentage of positive cases for screen typing, basically. So they're determining if a specimen sent to them is a variant or not. So we don't have the option of testing a specific case for whether or not it's a variant. It's a state monitored program. So they're only testing a small percentage. So we don't actually know how widespread this is, but we suspect that it's very widespread, and probably the dominant variant in our region right now is this UK variant, which is, you'll also see it as B117 in the news. So we have a significant amount of variant spread. In addition to this, we have restrictions that were relaxed in early March. So the combination of relaxed restrictions, opening of indoor dining, bars, sports, schools, things like that, led to what's now an active surge in our state. So in some ways, it's almost like a new pandemic because it's a very different virus and how it acts. It's about 50 to 75% more contagious than the non-mutated strain, this UK variant. So, so in a susceptible population like our young folks, in particular who aren't vaccinated, you'll see that it's spreading rapidly. So the other thing that this means is that we will need higher numbers of community members protected with a vaccine to reach herd immunity. So that number of herd immunity is based on the infectiousness of the virus in question. So a classic example would be measles, where you really require like 90 to 95% of the community protected to prevent it from spreading. And that's why that's typically the first infection that comes out in an under-vaccinated population, because it's so incredibly contagious. But this UK variant will probably increase the amount of numbers that we need for protection. So, so again, we urge you to get vaccinated if you have the option. And as of earlier this month, anyone older than anyone 16 and above can get vaccinated. So please, please go get your vaccine if you're able. You may wonder, why is Michigan being hit with this variant? Why are we, of all states, having such high numbers? That isn't completely clear. One theory is that Michigan had really low numbers for a long time. You'll remember that we had a bump in April of last year when it was initially coming out. Much of that was in southeastern Michigan. And then we went a long time with fairly low numbers until the winter, when we had a large surge over December and January. So one theory is that we didn't have many protected patients in our population, and so it was kind of fertile ground, they say, for this variant to spread. So what we'll likely see in the coming months, weeks to months, is that this scenario in Michigan is going to spread kind of throughout the country. And unfortunately, as much as we're vaccinating, there are still a significant proportion of patients, particularly community members, particularly younger folks, who aren't protected. So I would expect to see what we're seeing in Michigan throughout much of the country, unfortunately. So again, we would urge you to get vaccinated if you can, anybody 16 and above. From what I've heard, talking to my patients and friends, it's fairly easy to get that scheduled. So please, we encourage that. One thing they wanted me to mention is whether or not you should still get the vaccine after you've had COVID. And it is recommended that you still get vaccinated. And there are a couple of reasons for that. One of which is that your response or your protection after a natural COVID infection is heterogeneous, which means it's not reliable across the board. There may be some folks who have good protection for 6 months or more, and there may be some who are only protected for a month or less. So particularly older folks and those with immune deficiencies would probably not mount a prolonged response. Whereas with a vaccine, it appears that the degree of protection and the duration of protection is more reliable. So we would ask that even if you've had COVID, that you still get vaccinated. We're still getting some questions about, or concerns that this is simply like influenza and that that we're overreacting. I can guarantee you this is much, much different than influenza for multiple reasons. One of which is that it is clearly not seasonal. It has been active throughout the world, regardless of the season, regardless of the temperature. The amount of cases for every primary case is significantly higher. So it's much more contagious, and the fatality rate is significantly higher than influenza. So there are multiple reasons why this is much, much worse than influenza. We need to be taking it seriously. I guess I'll talk a little bit about the disease in younger folks a little bit more. So what we've seen in the hospital, as Dr. Nefsi reviewed, is that we're seeing younger patients admitted, and notably, very few of them end up on a ventilator, and the mortality rate is quite low. But it should be clear, this is a serious infection. Even if the patient recovers, many of them are getting long-term symptoms, which can be quite debilitating. So I don't want you to look at the mortality data or the amount of patients on a ventilator or in the ICU. That's not the whole picture. There are many patients who get this, some of which aren't even admitted to the hospital, who get long-term debilitating symptoms. So would consider that. And then there's this multi-system inflammatory syndrome that children can get. And remember, there's no child under the age of 16 that has vaccination protection. None of these are approved. None of these vaccines are approved for that age. So this is fertile ground. Lots of susceptible hosts with a very infectious circulating virus. So we want to be very cautious. And one of the reasons why we would recommend vaccination is to protect those younger folks who can't yet get the vaccine, but who could still have a serious complication.
I do have some updated data on children and those hospitalizations. What we know from the state of Michigan is so far we have had 28 cases of the MIS-C. Over half of those patients are male, 64%, and the average age is 8. 60% of those kids require an ICU. I think the other important part is some of these kids were completely asymptomatic when they got COVID-19. Some parents didn't even realize until they got admitted later that their child had even been exposed. So those symptoms of the MIS-C can develop up to 3 to 4 weeks after the initial infection. There's no rhyme or reason, no correlation at all between the severity of symptoms initially and the development of this complication. So we are learning more about it, but it is a serious illness, as Dr. Ledke relayed. And certainly these are children that don't have an option right now of getting vaccinated. So everything that we can do to protect our most vulnerable, and as a pediatrician, that's our kids, I'd say it's important for us to do.
Thanks, Dr. Nefsi, and thanks, Dr. Ledke. Can you both also comment on this next slide, which is related to quarantine and any advice that you have in working with the local health departments to help not only protect all of our populations, but specifically these children who are being impacted now?
Yeah, thanks, Diane. That's, I'll let Dr. Ledke maybe talk a little bit more about the 14 days, versus the 10 and, where some of those recommendations came from. But I do want to make a point. The state as well as the CDC did recently come out and suggest that Michigan pause on athletics as well as school going virtual for 2 weeks after spring break. And I know that there was a lot of pushback specifically to health departments as well as overall to kind of what people view as that shutdown. In the face of not wanting to further shut down or go back to where we were, I just want to make a couple of points. There are things that we can do that we know work. Those things have been in place from an epidemiologic and a public health standpoint for a really long time. So one is, if you are sick, don't go to work. If your kid is sick, please don't send them to school. We have screening tools in place at many workplaces. I know that the school districts have asked parents to do the same, to screen their kids before they go to school. Even if it's just a runny nose, please don't blow that off as being allergies or just a cold. If your child is sick or you are sick, please don't go to school or to work. And if you do have any symptoms at all, please get tested. We have lots of opportunities around the area to get tested now. The second thing, or maybe that's a third point, would be if you get contacted by the health department, please cooperate. They are really doing the work to keep all of us safe. And if you have had an exposure or you are at risk for some reason, cooperating with the health department and allowing them to get a bigger global picture of what's going on in our community is really imperative to them being able to do their work well. So if the health department calls you, please pick up the phone. Please cooperate with them. And please understand that they are really just trying to do their job, which is to keep all of us safe. So as frustrated as people may be, just like always, we say be kind. People are just trying to do their job and they really are trying to do the right thing. The next thing is, if you are positive or you are exposed significantly, please isolate and quarantine. That is the way that we are going to keep this from spreading, is if we follow, that advice of our health department and others and quarantine or isolate appropriately. And then the last one is what we've been pushing for a while now is vaccinate. We've got lots of good data and we know that vaccines work. So please vaccinate if you have the opportunity.
Thanks, Dr.
Ledke, anything to add?
Sure. Let me just add, because I'm sure this will come up. One kind of ray of sunshine in all this is that our vaccine that we're using, the RNA vaccines in particular, work really well against the UK variant, and that's been studied. And so the dominant circulating variant seems to respond really well to this, to the Pfizer and Moderna vaccines. So that's why the quarantine instructions for those fully vaccinated haven't changed, because it's reasonable scientifically that if you are exposed but you're protected with a vaccine, you should be able to continue your day-to-day activities.
Thanks, Dr. Ledke. And can you just also just comment on this slide, which is, I think there's a lot of confusion around quarantine guidelines and for how long someone should be quarantined.
Sure. Yeah. I mean, this is kind of out of caution, and it's a reasonable strategy at this point. And one of the things that should be clear is that this variant, the UK variant in particular, seems to release virus at higher amounts and potentially for longer than the native or non-mutated strain. So patients could potentially be contagious for longer than they would typically be. So I think one of the things they're trying to prevent is somebody who could potentially still be contagious and be spreading this without knowing. So this is reasonable, knowing how this new variant acts, to ensure that a 14-day time frame is maintained.
Great, thank you, Dr. Ledke. I'm not sure if we have one more slide or if we're gonna go over to Nick now. Oh, all right. So Dr. Ledke and Dr. Nefsi, I'll have you back in a minute for the Q&A session. But right now I do want to give Dr. Nick Tourney, infectious disease pharmacist with Munson Healthcare, an opportunity to make some comments. And specifically, if you've been following the news within the last 24 hours, we're hearing a lot about the Johnson & Johnson vaccine. So Dr. Tourney, we're excited to hear what you have to say about that. Welcome.
Yeah, good morning. Thank you, Diane. So the FDA and CDC have recently published a press release as a for a recommendation to pause Johnson & Johnson vaccinations at this time. And this is out of an abundance of caution as they investigate reports of a rare blood clotting disorder in 6 individuals in the United States that received the J&J vaccine and developed a rare blood clot between 6 and 13 days after the vaccine. So of note, this was 6 cases identified out of 6.8 million doses given, and there was 1 death that was reported. Right now, the adverse events appear to be extremely rare. The recommendation to pause the J&J vaccine efforts is out of an abundance of caution at this time, and the FDA and CDC are expected to review those cases and provide further guidance tomorrow. A few comments on this. This is really why we conduct post-marketing safety studies and evaluate and identify these safety concerns. When millions of vaccinations and millions of drugs are distributed to the public, rare events are going to be identified, and that's really expected. And to reiterate, this event rate is 1 in 1 million, which is extremely rare. To put this in comparison, the event rate for getting blood clots in women that are taking birth control is up to 1 in 1,000 per year per woman who is taking birth control, which is about 1,000 times more risk compared to getting a blood clot based on to the Johnson & Johnson vaccine based on the current data that we have available. And the risk of this possible adverse event is really in magnitudes lower than the risk of acquiring COVID-19 for yourself, for your loved ones, and for your community. So of note, I just want to mention that there have not been any of these, any reports related to blood clots with the mRNA vaccines, Pfizer and Moderna. So it is still recommended to continue vaccinations with those vaccines. And again, we do expect guidance soon related to the J&J vaccine from the FDA and CDC. And I know we have been getting some questions about if you have received the J&J vaccine, what do we recommend? And at this time, the CDC recommends to monitor for severe headache, severe abdominal pain, leg pain, or shortness of breath within 3 weeks after vaccination. And if any of those do occur, to contact your primary care provider. So that's first and foremost, I wanted to comment on that, and also just mention that clinical trials have been performed in all 3 of these vaccines that are available in the United States. They've been very rigorous, and there have been no shortcuts associated with the testing of those vaccines. And again, the post-licensure safety studies are needed in order to determine those rare events, those 1 in a million events that can occur, not just with vaccines, but really with all medications that are introduced to the society. And the risk of those are again much lower than any risk and downstream side effects associated with COVID-19 in our population. Another method that the FDA uses to track the safety of vaccines is a program called vSafe. Everyone that has been vaccinated in the United States is given information about how to sign up for vSafe. So it's a smartphone app essentially, and the program sends out a text message to you on a programmed basis, and you report back your symptoms. And then essentially this data goes to the FDA, who then is monitoring this. And this is how we identify in a very quick time frame how if there's any concern for rare adverse events. And also, there's another method. All vaccine providers are required by the FDA to report the following vaccine-related events after a COVID-19 vaccine. So if there's any vaccine administration errors, any serious adverse events, we mentioned cases of multi-system inflammatory syndrome or cases of COVID-19 that result in hospitalization or death. And so this is another way that in real time, the FDA is able to monitor if any of these 4 on the screen here if any of those do occur, and are able to respond to that. Next slide. And so just to, I know we've talked about this a lot, but there are, expected side effects, not just from any of the COVID-19 vaccines, but any vaccine. And those would just be a sore arm, localized pain, and redness, maybe warm to the touch, potentially some more systemic symptoms like a low-grade fever, nausea, headache, a general not feeling well. And this is really to indicate your body is building an immune response, which is a good thing. And again, I just want to reiterate that side effects of vaccines are in magnitudes lower than any adverse event from COVID-19, and passing that on to loved ones, to friends, to the general community. Next slide. And with that, I'll end, and Diane, we can go on with more questions.
Great, thank you, Dr. Tourney. Appreciate those comments, and especially the latest news on the Johnson & Johnson vaccine. Well, I'll start there with our questions for you, Dr. Tourney. The Health Department of Northwest Michigan has just announced that per CDC guidance, they will discontinue the use of the Johnson & Johnson vaccine until further notice. Is Munson Healthcare doing the same thing?
Yes, we'll be following that guidance as well. And that guidance, not only comes from the FDA and CDC, but the MDHHS, the state of Michigan.
And I do just want to note for any Munson Healthcare employees who are watching this, we did send out notification yesterday to all employees and providers across the system, letting them know that we did have Johnson & Johnson vaccine, and we were going to be opening up some employee clinics to do that. That is obviously not occurring now, so we are adjusting to this news and are well aware of this restriction now, and we'll be monitoring the situation and letting employees know how to get vaccinated in other ways. So thanks for that. Let me go to some of our other questions that are coming in from some reporters here. So Dr. Nefsi, how will this Johnson & Johnson kind of rollback impact the ability to further vaccinate Northern Michigan? You mentioned that the Northern Michigan stats are a bit higher in vaccination rates than across the state. Do you think that this is going to hinder our ability to effectively vaccinate people quickly?
I don't think so. We were hopeful to use the Johnson & Johnson vaccine in certain circumstances, since it's a one-dose vaccine and didn't have sort of the the same storage requirements that some of the other ones did. We'd actually up to now received very little of that vaccine. And so the vast majority of what we've been giving has been Pfizer and Moderna. I would imagine that those manufacturers will step up to the plate, and we will continue to use that in place of even those other populations that we were hoping to use the Johnson & Johnson for. So I will imagine that we will continue to do a strong vaccination effort across our Northern Michigan region. Much of the Johnson & Johnson, the state was allocating towards colleges and that kind of thing to try to do large numbers of our younger population. So we will adjust, and we will continue to vaccinate with what we have.
Great, thank you. Next question is for Dr. Ledke. You mentioned a lot of great information about these variants. You did mention that the current vaccines we have do help protect us from these variants, but are we seeing any different symptoms with the variants?
No, not really. It's the ones in the hospital, the ones that we've seen locally have been very similar to those who have had the native wild type COVID. So I've heard, this is kind of hearsay, but I've heard some parts of the state are having more kind of like cold and rhinovirus-like symptoms in younger folks. And I know, like, for my kids, part of their screening is whether or not they have nasal congestion and things like that. But I can't say for sure that that's related to the variants. I have not heard any definitive difference in symptoms. I think for the most part, it would just be the typical COVID symptoms that we've seen this whole time.
Thanks. And I know Dr. Nefsi did mention that even if you have a runny nose, please consider that a word of caution and get tested and don't send your kids to school or go to work because you're right that these symptoms could show in different ways. Dr. Ledke, can you also speak to the risk of those who are vaccinated transmitting without symptoms?
Sure.
How prevalent is that and what is the risk?
Yeah, it's very low. So this specific question has been on the minds of a lot of providers and health departments. There isn't a definitive study looking at this specifically because, if you think about how the vaccine approval study works, is they basically inoculate a large population with the vaccine, and then they determine who gets symptomatic COVID. It would be a very different study to inoculate all those and then test them for asymptomatic COVID at regular intervals. That would be very difficult. We're talking 30 or 40,000 people. That would be very difficult to do. There was a population-based study from Israel that was published in New England Journal of Medicine, where they looked at a cohort of vaccinated folks who got confirmed asymptomatic disease, and they found a protection of about 90% to prevent some asymptomatic shedding. So biologically, it doesn't really make sense that a virus would infect you and be able to replicate with protection, immune protection. So I think the risk is very low. It hasn't been specifically evaluated in the literature, but from what we see so far, it seems to be very, very low risk.
Thank you, Dr. Ledke. Next question is for Dr. Tourney, and it's related to the vaccine. Is this latest information with Johnson & Johnson further reason to not be vaccinated? And was something like this expected? Does this happen as part of the manufacturing process?
So no, this is not reason to not be vaccinated. Again, both the mRNA vaccines, there have been no association with blood clots with the mRNA vaccine. So at this point in time, recommendation is to definitely pursue vaccination with those products. And again, this is a very rare event, unexpected, but very rare, 1 in a million. And you don't know when those occur until you have millions of doses that are distributed among a population. So I think at this point in time, further analysis has to be done. And the process is working of this, identification of potential safety concerns. So I think it's important for everyone to understand that this process in place is meant to catch these things, and this event, if it is causation, which we do not know if it is causation at this time, is extremely rare.
Thank you, Dr. Tourney. This next question is for Dr. Nefsi, and it's related to women's health issues. So someone's hearing that the vaccine is affecting women's menstrual cycles and saw a story about lumps near the breast post-vaccine. Can you speak to that? And I know that there were different guidelines around mammograms and when to receive a mammogram after vaccination. Can you speak to that again, please?
Yeah, so let's just start with that. What we've heard and what we've had Dr. Tourney and Ledke and Cannon and a lot of other people tell us throughout this is that you can get some mild side effects from getting these vaccines. And those side effects really are your immune system kicking in. Part of our immune system are our lymph nodes. And often when you have a vaccine or anything like that, you can get some inflammatory response in your lymph nodes. And since we are giving vaccines in the arm, the armpit or axillary lymph nodes are where you would often see those lumps, so to speak. So we aren't seeing lumps in the breast. We are seeing some people that will get what we call regional lymphadenopathy, which just means some mild swelling of the lymph nodes in their armpit on the side that they got the vaccine on. Very normal immune response, nothing to be alarmed about. But because, when we do mammograms and those very sensitive studies and we look at that kind of thing, we did make the recommendation to delay for several weeks a mammogram if it was just a screening mammogram until after, so that we give time for the body's natural immune response to tamper down after the vaccine, and we don't have that threat. I have not seen anything to suggest that women getting the vaccine get lumps in their breast. I have not seen anything specific to menstrual cycles either, although we know that stress and a lot of other things can impact that. I haven't seen any studies. I don't know if Dr. Tourney or Ledke have heard anything different, but I haven't seen anything about that.
Okay, thank you. Dr. Ledke, are the positive cases that we're seeing those without vaccines or with vaccines? Do we know the rates there?
So the vast majority of the positive cases we've seen are unvaccinated. We've seen here and there a few cases, which is kind of expected. I mean, the vaccines are not 100%. So those tend to get reported and communicated, and so you may see in the news or hear on social media that I got the vaccine, but then I still got COVID. That's still possible. But one thing you should be aware of is that you're very, very unlikely to have the vaccine and get COVID and have a severe case. So it's very, very likely to protect you from getting COVID at all. And if you are going to get COVID, which again is very low risk, you're likely going to have a very protracted or mild case. So again, the positive cases that we've been seeing have been younger, unvaccinated patients, and with a few here and there positives after vaccination.
Great, thank you. I'm going to ask this of Dr. Nefsi first, but I'm not sure if others want to comment on it. But have we seen any children locally who have had the multi-inflammatory symptom complication after COVID-19?
I know that we have had a number of children hospitalized. I don't know the details of their case once they were transferred. So.
Right.
Yeah, I've heard of a few, a handful,
Okay.
but I can't give you exact numbers on that.
Okay, thank you. Dr. Tourney, this next question is for you. Is there any more information about how long immunity will last after being vaccinated? How long are we protected once we have a shot, basically?
Yeah, so at this point, it's looking like about 6 months, and that number is really dependent on how long we have been able to study these vaccines. So it looks like immunity from vaccination lasts up to 6 months, but that may be longer. And whether or not we need a booster vaccine or how long that immunity lasts from one series of vaccines is yet to be determined.
Great, thank you. We're getting quite a few questions on specifics related to, whether or not a woman should be vaccinated if she's taking birth control or have had previous issues with ITP. And I believe that's probably related to the blood clot question. Dr. Nefsi, do you have any comments on that or any advice for where those people can go for specific information?
Yep. Again, always I advise speaking to your healthcare provider about making the right decision for you based on what your health history is. I think, what Dr. Tourney illustrated earlier is that, we have been able to study specifically the mRNA vaccines for a long time and have found no correlation or risk for that population that you just mentioned. This most recent pause is exceedingly rare, and still we are looking into sort of correlation versus causation. So again, I think the mRNA vaccines have been studied for a long time and are safe, specific to many of those patients that you just discussed. But always, if you have questions, you should speak to your provider. And if you don't have a provider, we do have the nurse hotline that can help guide you. In addition, the CDC, as well as the Michigan Health Department's website, has a lot of great information and questions answered on their website.
Great, thank you all. We are unfortunately out of time here today. I do want to get to a couple of last slides, but before I do that, and while that information is being posted there, we are getting, we have a question about steps recommended to boost my child's immune system to actually protect them against COVID-19. So I think that's a great question. And I think that's a question many of us have had, even as adults, of, you know, what can we do to keep ourselves healthy and boost our immune system? So I'll look to our marketing and corporate communications team to look into some information on that and talk to some experts and get some information posted on our blog and our FAQs related to that, because I think that's some good information we can share. There are some really great informations already on our blogs about resiliency and stress reduction, which we know can all help keep us healthy. So please look for those resources, and then we'll include more as they become available. I do want to take a minute to just, you mentioned those, we saw those resources available for the community and the local health departments. Again, reiterate, you can call 231-935-0951 for our Ask a Nurse hotline. And I just really want to thank Dr. Nefsi, Dr. Ledke, and Dr. Tourney for their time today. I know how busy you are, and it's this is just really helpful to help keep us all informed. We will look to have the local health departments back next week for their updates. And of course, we'll keep you posted on the latest that we hear on the Johnson & Johnson vaccine. In the meantime, please sign up for our newsletter, follow us on social media, and visit munsonhealthcare.org for more information. Thanks, everyone, and have a great day.
Thanks, Diane.
Thank you.
Thanks all.